Hi there, my name's Nick Fitzhenry. I'm a PhD student in the Department of Economic History at the London School of Economics. Today I'm going to be telling you a bit about my research and explaining its relevance to students of economics. My research sits at the intersection of historical demography, economic history, and public health, and I focus on my home country of South Africa during the 20th century. South Africa is a country with deep and persistent inequalities. For much of its modern history, the white minority, about 9% of the population, enjoyed living standards comparable to the populations of the wealthiest countries in Europe. In contrast, the vast majority of non-white South Africans, further divided into three groups, lived in poverty, driven by racially discriminatory laws that systematically limited their economic opportunities, political rights, and access to essential services like healthcare. Doctors and hospitals were heavily clustered in areas predominantly inhabited by the white population, and in many places healthcare facilities were explicitly reserved for whites, providing more hospital beds and better resources. As a result, life expectancy for the white population in the 20th century was significantly higher, and remains significantly high today. Like Western Europeans, white South Africans had largely escaped the historical burden of infectious diseases like measles, smallpox, and diphtheria by the middle of the 20th century. In contrast, infectious diseases severely impacted the non-white population, the worst being tuberculosis. As an infectious respiratory disease, it thrived in crowded, underserved communities. For most of human history, there was no treatment for tuberculosis, so the outcome, in most cases, was death. My research specifically quantifies these disparities by examining historical mortality data. I've created unique datasets using archival sources, including district-level death registers, census records, and medical reports, spanning from the 1930s to the end of apartheid. Through this data, I can reveal not only persistent inequalities, but also moments when these inequalities unexpectedly narrowed. One fascinating example from my research is the health improvement seen amongst the colored population in the 1950s. This is a paradox because it happened precisely when apartheid policies intensified and economic opportunities were stagnating. My analysis suggests that this improvement was largely driven by a medical innovation, specifically the introduction and diffusion of antibiotics, which only arrived in South Africa in large quantities in the late 1940s. These life-saving technologies, despite being constrained by systemic racism, disproportionately benefited marginalized communities burdened by diseases such as tuberculosis. However, these gains were initially limited to regions with already high levels of doctors who could distribute the drugs. The white population, which had already escaped the burden of infectious disease, didn't benefit as much. Therefore, inequality was reduced. So, why should economics students care about this? I give three reasons. Firstly, my research underscores that health is a fundamental component of human welfare. As we've seen recently with COVID-19, millions of people are willing to sacrifice economic prosperity or political freedoms to ensure the health of their communities and themselves. Historically analyzing health outcomes provides students a richer understanding of economic welfare beyond traditional metrics like GDP. Secondly, while antibiotics in apartheid reduced inequalities in health, the equalizing effect of technology is not guaranteed. For example, in the United States, antibiotics initially widened the gap between black and white mortality. Technology can reduce or amplify inequalities depending on their accessibility and whose needs they serve. This historical perspective helps evaluate contemporary technological changes like AI or biotechnology and their potential societal impacts. Finally, history matters deeply for understanding present-day inequalities. The fact that a black person in South Africa today remains significantly more likely to suffer from tuberculosis than a white person is a direct legacy of apartheid. Economic history equips us to understand such persistent disparities, which is essential for crafting informed, equitable policy that might shape a better tomorrow.